The following segment is brought to you by Live Well New York. Visit livewellnewyork.com to find out how. And it's one of the most preventable diseases that almost any adult is at risk of developing. We're talking about type 2 diabetes, also known as adult onset diabetes, and it doesn't discriminate. Some of our favorite celebrities suffer from type 2 diabetes.
You just got to be Crystal. How are you?
Hello, Mr. King.
You've seen the B.B. King commercial with American Idol runner-up Crystal Bowersox. But did you know that Nick Jonas of the Jonas Brothers suffers from it?
In 2005, I was diagnosed with diabetes. I became one of the 3 million Americans with type 1 diabetes.
So does box office superstar Halle Berry, singer Patti LaBelle, rocker Bret Michaels, American Idol judge Randy Jackson, talk show host Larry King, and the legendary Tony Bennett, and our friend actress Elaine Stritch. The list goes on. Here are some sobering facts. 90 to 95% of people with diabetes suffer from type 2. Symptoms caused by type 2 diabetes often develop gradually, are often mild, but if not properly managed, complications include stroke, kidney failure, heart disease, blindness. The list goes on. For prevention and diet advice, we sought out nutritionist and diabetes expert Megan Fendt. Diabetes is often called a silent disease because there are 1.2 million New Yorkers, it's estimated, that don't know they have it. What are the signs?
Some of the frequent signs of having diabetes can be frequent urination, really sudden weight loss, constant thirst, constant hunger, and those are some signs that your blood sugar is constantly elevated.
And how do you find out? You go take a blood test?
Yeah, to get tested for diabetes, you would go to your physician, get a blood test, and they would look at your glucose levels, your blood sugar levels, to see if those are higher than they should be.
If you're diagnosed and if you take care of yourself properly and you change your lifestyle, there's a lot that you can do and live in a very healthy way.
Absolutely. The number one thing that we talk to our patients about is how to eat. What you put in your mouth can really affect how your blood sugar levels are and what's going on in terms of complications.
Bottom line message then is check out your risks. Find out if you have it or not through a simple blood test, and also you can take this risk assessment test on the website, which is?
Diabetes.org. It's the risk assessment test, so you can figure out whether you're at higher risk for developing diabetes.
And then
eat well, eat less, smaller portions, and everything will fall into place.
And here's an event for Diabetes Awareness Month. On Friday, November 18th, from 10 to 4 at the Friedman Diabetes Institute will be their annual diabetes fair. Stop by if you can. There's holiday eating advice, dancing, and yoga. And we'll be right back.